So I'd like to welcome everybody to our official webinar. Tonight I'm joined with Christine Henley. She's going to be talking about some brain injury-related partner violence, I do believe. And we're going to go through. Matt's not with us tonight, but we're going to go through the interview and one step at a time. So Christine, if you could introduce yourself, that'd be great. And we'll get right down to what we're going to do here tonight. Thank you.
Yeah, thanks. I'm honored to be here. Thanks for the welcome. I'm Christina Henley. I'm here, I suppose, through the Brain Injury Association because we'll be talking about intimate partner violence related brain injuries. Quick bit about me. I facilitate this now almost provincial program through the Brain Injury Association where I facilitate training to service providers, helping people understand the intersection of IPV-related brain injury and raise awareness really and help understand some of the symptoms associated with it and help mitigate these symptoms. I used to work at the Sexual Assault Support Center as a family court support worker, so I have a lot of visibility into some of the barriers that exist for this population. I'm now a clinical practitioner where I'm counseling, so I do individual practice. I get a lot of individuals experience trauma. I work with teens as well, youth are at high risk, couples and families. So that's something I do. And my own lived experience became the catalyst to my own passion for this, what I'd call, public health epidemic.
Yeah, I think we teach courses for self-defense for women, men, and everybody, and I think that there's a not misunderstanding, but a lot of non-education as to how some things happen in relationships and how how bad it can get, and maybe there's things that we can help you to understand more of the other side of it to get an understanding of how it kind of works. So, what are some of the stats around domestic violence for brain injuries?
Yeah, so the numbers are pretty staggering. In 2021, the World Health Organization declared that 1 in 3 women worldwide will experience physical intimate partner violence, and 75% of those survivors will experience a brain injury. This pretty much equates, when you do the math, 1 in 4 Canadian women will have a probable intimate partner violence related brain injury, and a vast majority of them go undetected and unsupported. If you look at it comparatively, the government of Canada reports that 1 in 8 women will experience breast cancer. So, in other words, IPV-related brain injuries are twice as prevalent as breast cancer. So as I said, these numbers are staggering.
Wow. Does that stat go? Is it for men and women, or is it more like how does that stat work? Is it broken down into different gender?
Yeah, a lot of the research is focused on women specifically because women uh, tend to be the ones that experience the violence the most, and they experience the worst outcome in terms of brain injuries. So these stats do focus on women, yes. And there's no question of doubt that men do experience intimate partner violence as well too. But a lot of the research that I focus in anyway is around the female brain.
Okay. No, and that makes complete sense. I just want to kind of ask the questions to clarify. And then,
Yeah.
what makes these brain injuries so dangerous? Obviously, I can see there's a problem there, but what's going to be is going to affect relationships, and then what makes it dangerous in general?
Yeah, sure. Well, these brain injuries specifically, they are lifelong injuries, usually causing everyday disability. And that's because we see usually repeated brain injuries. So you're seeing these brain injury symptoms over time. And because they're undiagnosed and untreated, the more someone gets, the worse the outcome. And a traumatic brain injury, concussion symptoms, it can be caused by, being held underwater, thrown against the wall, thrown downstairs, so severe rotation of the head or neck. But when you look at brain injuries in domestic violence, 92% of them are blows to the head, face, or neck. So it's not surprising that someone would have more than one brain injury. Um, what's really dangerous is that strangulation is the most fatal and dangerous form of intimate partner violence. It increases death in following assaults by 748%. And that's hasn't been a typo. You can see a death up to weeks later if somebody hasn't identified the symptoms, or they weren't identified in the ER. And there's a lot of leading impairments that go along with a brain injury. There's physical symptoms, cognitive, communication disorders, mental health issues, and
Does it lead
mental
to,
health.
sorry, does it lead to problems too in like future relationships if it's not diagnosed or recognized?
I mean, it's hard to say. Yeah, I mean, if there's memory issues, problem solving, difficulty initiating tasks, um, it can be combined with anxiety, depression, personality disorders, addiction. A lot of times, too, if somebody's lost their job or they can no longer parent anymore, for instance, they lose their sense of identity, sense of self. So they become very isolated within that brain injury.
So how do so survivors of that, how do they cope? What are the things they're going to face going forward? And is there ways that they can get treatment to help to make things better? Like do these type of brain injuries, do they go away or are they lifelong?
Well, there's definitely ways to mitigate symptoms if they're diagnosed, if they've got a doctor. Sometimes, depending on the population, they might have a transient life, thereby not seeking medical supports. Uh, but new research has shown through Dr. Ann McKee out of Boston University. She's a neuropathy specialist. She's come up with what's called chronic traumatic encephalopathy. And that's a very fatal brain disease that happens over time from traumatic brain injury. And it can lead to dementia. You can only see if an individual has it after death in autopsy, but you can see the brain matter has very much shrunk. And what they're seeing now in women that have experienced violence and repeated brain injury, they've got this CTE very often and very young too. I mean, it can happen in the course of 5 years. And if it's undiagnosed, then the consequences are serious.
My question was like, how is it diagnosed? Is it just through a doctor or
Yep,
is it?
just a medical doctor. If they're speaking with healthcare practitioners, for instance, a healthcare practitioner can use a screening tool uh, to help them along. And then once they're in the doctor's chair, then they can get the diagnosis. It does require a CAT scan or MRI. Usually an MRI is best to detect a brain injury.
So I guess the question, I guess then, so if somebody's diagnosed with this and they're in a relationship that's abusive, what are their steps to get out of there? What are the steps they can do to help themselves? Um, to get to like either safety or make some changes if they recognize and they know what's going on, they need to get out.
Yeah, I mean, escaping violence is very challenging, as you can imagine. They're dealing with complex trauma over time. There's a trauma bond that's going on within the isolation, the brainwashing. Um, it's a very up and down cycle of violence, and usually the violence escalates. Uh, when you see youth experiencing violence, parents are trying to support. We usually suggest, just keeping open dialogue with your teen, not blaming the perpetrator, of course, but really just sort of working at, hey, these are the serious implications of violence over time. But it is and can become very difficult for a woman to escape because children are held over their heads or their jobs, finances could be an issue, or housing, and of course that threat that they could be killed if they leave.
So you use the word trauma bond there. Can you explain what that means?
Yeah, because it's a complex attachment to the individual themselves. They're dealing with this attachment through trauma. So it becomes, I mean, not like an addiction, but similar to that attachment to keep going back because they're so isolated. They believe that this is the only person that will love them for some of the issues that they may be dealing with. There's also threats to hurt, there could be threats to hurt family members, hurt the kids. So, yeah, escaping violence, as I said, is a very complex and dangerous event because, of course, when a woman escapes violence, that's the most fatal time.
Right. Okay. And then,
Mhm.
so if they're escaping, then what are their options? Where can they go?
Well, if they have nowhere to go in terms of housing, they can go to Women's Crisis. I work extensively with Women's Crisis in Guelph, Wellington, and here in Waterloo Region. Um, they can start working with their employers if they're still employed. The biggest, I guess, important thing is that they try to get their friends and family back because very often they become quite isolated, which sort of ensues them staying. But there is supports even if they have to go through family court. There's family court support workers available at the Sexual Assault Support Center. There's been trauma uh, where there can be, free legal counsel in that case. But it's important to, not fear the police. And sometimes even the law is feared. At times they don't want to talk to doctors. So at that point, being able to talk to somebody in confidence.
Finding somebody you can trust outside of that circle that they were in, that they feel that they can speak with and hopefully get the help that they need. And I'm sure that's not easy at all. I know that when we've taught courses here, sometimes I know that we can tell if somebody's been through trauma. There's different giveaways. I just watch them physically and how they respond to certain things. And, they're welcome to sit out of the course or that part of the course and stuff. We always encourage, but we never would force anybody to do anything. And then we always encourage them to come back for another course. We just offer those for free until they can get through the things that they're working through and they get that confidence back. So they have an idea of, that they feel better in that situation. I mean, hopefully it would never happen again, but I could see how the triggers would definitely bring that about and cause things to happen and take them back to that moment. And I can only imagine what it would be like to work through that. And it would be different for everybody depending on what trauma they were dealing with, I'm guessing.
Yeah, exactly right. Yeah, absolutely.
And I think that probably through counseling, if like good counseling should help that become better over time, as long as the counseling going in a positive direction and helping them with what they need.
Mm-hmm. Mm-hmm. Yeah, taking sort of a holistic approach, through mindfulness. Actually, one thing I didn't mention is that I'm also a yoga therapist. So I do bring my yoga therapy into practice. And I designed and now facilitate an adapted yoga for um, IPV survivors. And I offer that through the city of Kitchener. It's a free program offered once a week where it's a trauma-informed group. And it not only helps people and individuals to learn yoga techniques and mindfulness to mitigate those brain injury symptoms, but it also creates agency within the group because they've all got the same lived experience. So this private and safe group also provides them that ability to share.
So what give me an example of something you might do differently in that yoga class to kind of bring the group together or, do something to change what maybe a normal yoga class would be?
Yeah, there's lots. There's a lot of triggering things in regular yoga. Downward facing dog, forward folds, anything the head is upside down, hand balancing, headstands, things like that. Like the list goes on. But you want to down regulate the nervous system and really work on grounding postures and really balancing both feet, for instance, if needed.
Oh, okay. So you change it to make it adaptive to work better for the class, so it doesn't, you don't hit those triggers, so to speak.
Yeah, I'm working specifically around the brain injury piece.
Right.
A few years ago, I did my advanced neurorehabilitation certificate through Brock University, allowing me to not only know my own symptoms, but to also work with others. So I was able to adapt all of my yoga teacher training and adapt it to somebody that has a brain injury.
Oh, that sounds great. So if you were to come across somebody that you think might have like a brain injury related to this, what would be the steps? How would I find help for them, or what can I suggest? as where they, I think we've kind of talked about, but I just want to ask again, just to make sure that we cover that, because I think this is super important.
Yeah, I think the most important thing is that they've got the support through trusted ones, whether it's a family member or friends. Definitely get a doctor. If you don't have one, get on a list because it's important to have a doctor following you throughout, especially if you can't work and ODSP is needed, so Ontario Disability or financials. There's a lot of things to cover within housing and medical care. Uh, but through that doctor's support, then there can be proper referrals taken. Um, if the police need to be contacted for criminal charges and whatnot, then that's an option. But starting with a medical doctor is always the way to go.
Okay. No, that's great. I think, is there anything else that you can think of that we can add into this to kind of help people out to understand a little bit more? I think your breakdown is great. It's something that until we talked a couple months ago, I didn't even think about. And it
Yeah.
sure opened my thought process once you said it. Now we've had this talk even more so, because I can think of different times in my life when I've met people that maybe have had these traumas and I would never have recognized or known it. But knowing the characteristics from past things that they've done or people they've been with, you can
Hmm.
see that maybe that was part of things that were going on. But to have an understanding of it, just to hear this, it's a bit different.
Yeah, well, as I said, escaping violence is very, very complex trauma, but you can imagine how much harder it is to escape violence if you have a brain injury on top of that, when
Right.
your cognition is affected, your communication is impacted. So that's where my program is very significant within the region because I'm working with organizations to raise this awareness, thereby increasing the awareness in survivors themselves. But it's so important that, if there's any sign of any head trauma, strangulation, being held underwater, any of those things, then really I would suggest talking to a doctor. Um, and it's also very important to understand too what phase of violence a survivor is in terms of escaping violence, because a diagnosis can actually, unfortunately, because of the stigma associated with intimate partner violence, it can work against them if they're going through family court, for instance. Their lawyers, the perpetrators' lawyers, could use the diagnosis against them in terms of their independence, their ability to take care of their kids, pay the bills. So there's a lot of decisions going on during that time, depending on what phase of violence. If FNCF is involved, that's Family and Children's Services. And I've done lots of work with them to help them understand brain injury symptoms. But even that, the uneducated person or a judge or a lawyer can make some lifelong decisions for an individual if there's a diagnosis that's not kept private.
I think too, and you said there are like levels. Did you say levels of violence or levels of the threat that were within the relationship would affect it as well?
Levels of violence. I mean, violence can certainly increase over time. And, if you think about some of the, like when you look at the chronic traumatic encephalopathy that individuals can get from repeated brain trauma, well, an athlete can have that too. And rage is one of the biggest. Rage and aggression in both with females or males can experience that. So, depending on who you're dealing with and the dynamics of the couple, the violence could really escalate because both could have brain injury.
Right. So I mean, yeah. So if somebody had like a back concussion from something outside of the relationship to begin with, that maybe
Yeah.
wasn't related, but then brings it into the relationship, and then that rage kind of hits, and then it becomes much more, accelerated. And I'm sure that different people and different personalities could help accelerate that or de-accelerate it depending on what was going on at a much
Yeah.
quicker, slower pace as well. So very
Yeah,
interesting.
for sure.
I think that's all the things I wanted to ask. Is there anything else you want to add here that, for resources?
Yeah, for sure. You know what? I'll let you know quickly. And I printed off a list
Oh,
because
perfect.
they're hard. There's so many things that we do offer. In terms of resources, again, when a woman has a brain injury because of violence, the pathway for her to heal and have recovery, even to get medical supports, is always different. It's not as simple as like an athletic injury where they're hit on the field, there's signs of a brain injury, off they go to the
Right.
hospital and then treatment. There's all different avenues. But at the Brain Injury Association, for instance, we offer we're not a crisis organization. We're not women's crisis. But once an individual realizes, okay, I have a brain injury, I'd like to work with others that have brain injury, get involved with our community. We have some really great programming. We offer a peer support program where we match individuals with similar lived experience so that a survivor can get a phone call every week and talk to somebody that relates to them. Don't forget, a brain injury is very much an invisible injury. It's not like a bone broken.
Right.
So over time, having all of these deficits can be very stigmatizing. So having a support system in place, we offer that for free. We have art programs, both online and in person, that are very helpful, especially if somebody has lost their job, for instance, but they're wanting to build back agency. They maybe want to volunteer. We even have a store available where people buy our art made by brain injury survivors. We have virtual online support groups. We have in-person support groups. We also have technology support, and that's where if an individual has experienced violence, sometimes the perpetrator will break their phone, break their laptop, so they're missing technology. So we have a small budget to provide a survivor with technology if they've escaped violence. And I also want to mention Traverse Independence. I'm not sure if you're familiar with Traverse.
No.
They are an organization here in the Waterloo region that they help people get to independent living. So they're dealing with, motor vehicle accidents, ABIs where there's, stroke, but they have caseworkers that can work in the home or have in the residence that they offer to get people living independently. It's a great program, as I said, long wait list to get referred, and you need a medical diagnosis. If somebody wants to get involved with us at the Brain Injury Association, don't need a diagnosis. All you have to do is identify as somebody with a brain injury, and the services are free.
Okay, that's great. Wow. I mean, you always hope that nobody would have to ever need these services, but a lot of people do. I mean, there's so many things in this world that are not good right now, and there's a lot of bad relationships, and and sometimes it's not always meant to be that way, but it happens, and it's part of society, unfortunately, and it's something that needs more attention and needs to be dealt with in much different ways than it's being dealt with. And I think that education is one of the biggest things we can help people with, and this has definitely educated me a lot. It's good for me because we teach so many courses and we deal with so many different people that it just helps me understand things more, and I think it's very good for me to hear, and I'm hoping that when other people hear this, they'll feel the same way. So thank you very much. This has been really good. And
thanks, James. Yeah, I'm so pleased and thrilled to be able to spend this time and chat about this very important topic.
Awesome. Thank you very much. We'll stop our interview there, but this is fantastic, and we'll maybe have you back on a different time.
Okay, perfect. Thank you so much.
Thank you.